Hi everyone, my name is Nicole Julien-Connage. I'm a psychotherapist, counsellor, speaker and mentor. I have worked in the mental health sector for over 10 years now, working with children, young people and adults in many organisations, which include Childline, Mind, which is one of the biggest mental health charities in the UK. I've worked in inpatient psychiatric units, and currently I work for the NHS and in primary and secondary schools across London. So I'm here to give you a brief overview of neurodiversity and neurodivergent people. I say brief because neurodiversity is a huge topic, so it would be impossible to go through them all, especially in this short video. So just to give you a bit of an overview of what I'm going to be covering. First, I'll talk about what neurodiversity is. I'll talk briefly about who it affects. I'll mention a few neurodiversity disorders that are out there, just to give you a bit of an awareness of some of the others that are there. I'll focus a little bit more on ADHD, and I'll give you a little bit more information on that. And lastly, I will also talk about things that you can do and support that is out there to support those who are neurodivergent. So firstly, what is neurodiversity? Well, neurodiversity is a term that's used to describe differences in the way people's brains work. So the idea is that there's no correct way for the brain to work. Instead, there is a wide range of ways that people perceive and respond to the world, and these differences are to be embraced and encouraged. So basically, it's someone whose brain processes information in a way that is not typical of most individuals. So does that mean there's something wrong with someone if they are neurodiverse? Well, absolutely not. Neurodiverse basically means a neurological difference. So things like autism, ADHD, dyslexia, etc. are basically natural variations of the human brain rather than a disorder that needs to be fixed. So it means that people have different ways of thinking, learning and processing information, which can lead to many strengths as well as many challenges. Therefore, with these disorders, it's more about gaining understanding and awareness in order to work with the individual, rather than the individual with a neurodiverse disorder trying to work the way you do. So there has to be, I guess, a form of collaboration between the neurodiverse and the neurotypical. So who does it affect? Well, anyone, no matter of age, race or gender, can be assessed and potentially be diagnosed with a neurodiverse disorder. However, I think it's important to mention that social and cultural factors can sometimes deter people from being assessed. For example, a child who may be consistently forgetful or late may be seen as lazy or not paying attention, when actually it could potentially be a neurodiverse disorder. Equally, economical factors can also deter people from being assessed and becoming aware that they may be neurodiverse. For example, people who are in the lower economical bracket are less likely to be diagnosed, as it can cost over £500 for an individual to be assessed privately. But of course, you can get a referral from your GP to be assessed, but this can take some time depending on the waiting list in your area. So, what kind of neurodiversity disorders out there? Well, there's APD, auditory processing disorder. There's Tourette syndrome. dyspraxia, dyscalculia, dyslexia, autism spectrum disorder, ADD, which is attention deficit disorder, DLD, which is developmental language disorder, and ADHD, which is attention deficit hyperactivity disorder. And this is just to name a few. There are many, many more out there. Now, depending on the disorder, you may have a GP, psychiatrist, or educational psychologist or specialist to assess whether a person has any of these learning differences or disorders. But what are the signs and symptoms of a neurodiverse disorder? Well, there are some common issues and challenges that fall under some of the disorders, such as there are challenges with attention, organization, working memory, time management, listening skills, sensory perception, and speed of processing. Of course, everyone is different, so not everyone will tick all of the above, and some may have different symptoms. But I guess it's important just to be aware of some of the common ones that are out there. So let's look specifically at ADHD. So what is ADHD? Well, we know the main name for ADHD is attention deficit hyperactivity disorder, and it is basically a neurodevelopmental condition that affects the nervous system, including the brain, during development from childhood to adulthood. Now, people with ADHD can experience impulsivity, hyperactivity, distractedness, and also difficulties following instructions and completing tasks. Interestingly, males are 3 times more likely to be diagnosed with the neurodivergence than females. And also, it's important to mention that ADHD screenings help doctors identify children or adults with ADHD. And there's many adults who, until much later in their life, find out that they have ADHD because it may have been missed for many reasons when they were children. It's also important to mention that there is no single test that doctors can use to diagnose ADHD. Instead, like the many other disorders, they use basically a combination of interviews, written tests to identify behaviours that are symptoms of ADHD. And usually these are conducted by qualified healthcare professionals like psychiatrists, clinical psychologists, paediatricians, neurologists, and nurse practitioners. All of these professionals can carry out these assessments, which again would involve a combination of interviews, behavioural assessments, and sometimes input from teachers or parents, just to kind of get a more comprehensive view and a more comprehensive diagnosis. So what are some of the common ADHD challenges? Well, similar to some of the other disorders mentioned, there's time management, concentration, staying focused on one topic, rationality, and articulation. Again, not everyone would display all of these symptoms, and this is not just challenges associated with ADHD. As mentioned, this can also be present in many of the other learning disorders and differences, which again, I must stress, which is why it's really important to be assessed by qualified professionals to ascertain what a person may have. Now, in society, ADHD is understood to only having negative outcomes. But the more you learn about neurodiversity, the better you'll be able to see how ADHD, like many of the other learning differences and disorders, also have positive outcomes. For example, people with ADHD can be very focused and committed to projects and tasks they are interested in, which can actually make them super efficient. Their imagination can also create original ideas and unique solutions to problems. And despite periods of low energy, people with ADHD can have bursts of speed, enthusiasm, and determination. So let's look at mental health and neurodivergent people. Now, people often ask, is there a link between mental health issues and ADHD or other neurodivergent disorders? And the answer to that is yes and no. And the reason why I say this is because neurodevelopmental conditions such as ADHD, autism, dyslexia, etc. are not mental health conditions. However, being neurodivergent in a neurotypical world can lead to challenges that may increase the risk of stress, anxiety, or depression. And research indicates that neurodivergent people are more likely to experience mental health issues than neurotypical people. And I guess this link between neurodevelopmental conditions and mental health conditions such as depression, anxiety, and low self-esteem can basically be put down to a number of different factors. These include things like differences in the way they interact with the world and experience particular situations, which can lead to increased stress and anxiety. Many people who have these learning differences and disorders live feeling very precarious about their situations or jobs that they may be in. So there's always a feeling of sometimes feeling unsafe, particularly when there's a lack of support. And also, the other reason where there may also be an increase in mental health issues with those who are neurodivergent is also the negative attitudes and a lack of understanding from others, namely neurotypicals, which can lead to feelings of loneliness and feelings of isolation, particularly when it comes to relationships and social situations. So I guess that leads me to, what can you do to support someone with ADHD or who has a neurodivergent issue? Well, with an understanding of some of the challenges and strengths young people with ADHD experience, you will be better equipped to be a supportive resource. So, for example, the things that you can do would be, for example, is looking at things like communication. Communication is key. Speak clearly and succinctly. Use things like visual aids and timetables. These things can be really useful. Set clear boundaries, but also allow flexibility for change. Also, it's important to also mention that for some children and young people, they may also benefit from therapy or medication to help them to manage their symptoms. Encourage movement. This is really important. Provide physical activities that boost dopamine, like playing sports, exercise, things that get them moving, dance, etc. Provide opportunities for role play, so role play situations and things that are going on. And also ensure positive relationships with peers and adults. Remember that as a youth worker, you are... What is it that I'm saying? I guess remember, a youth worker is creative, engaged, and creates positive relationships with young people. Imagine how a young person feels when you understand their experience with ADHD or another neurodivergent issue. So I guess what's really important is that by having more of an understanding, you can help them identify and use their strengths to create positive outcomes in their life. So lastly, as I said, I can't cover everything in this short video, but if you would like more information and support for a young person or adult, you can always go to Young Minds. You can also visit the Childline website. There's also Action for Neurodiversity, which is an organisation which specialises in offering counselling and support for those with autism and also Asperger's. There's also the National Dyslexia Association, which have lots of information on their website. And of course, they can access therapy through CAMS or a mental health professional. Unfortunately, that is all I have time for, but thank you so much for listening. Take care.